The aim of this program is to help you understand how chemotherapy is given and how you can help manage some of the common side effects that may occur. The information is based on the experiences of people who have had chemotherapy and the best medical research evidence we have at this time. There may be aspects of your treatment, medical condition or personal circumstances that are not covered in this program. Your treatment team will be able to give you additional information about your specific treatment. It may be useful to get a pen and paper and note down any questions that you think of as you're watching this program or when talking with family or friends. You can then ask your chemotherapy nurse or doctor at your next appointment.
Hi, how can I help you?
When I was first diagnosed with cancer, it was a bit of a train ride, or a bit of a train wreck, I suppose, from there on.
It was actually a huge shock to me to find out it was Hodgkin's disease. I had actually no idea what Hodgkin's disease was.
And I thought about all sorts of ridiculous things about what'll I do when my hair goes, or how am I going to cope, and why will I be able to still mind the grandchildren?
I took it very strong. I didn't start crying and worrying about death, and I said, we all die one day. I might get hit by a car, who knows? And not everybody dies from cancer. Too many survive these days, and that's a good thing.
Nowadays, chemotherapy is quite effective. You get good results, and I could seek alternative treatment if I wanted to.
It was easier than I thought. In my mind, the whole treatment was getting bigger and bigger and bigger, but it wasn't too bad at all.
It was a very surreal experience because you really didn't know what was before you. And I remember when the drip went in for the first time and smelling the chemicals and just waiting to see what was going to happen.
Before having chemotherapy, it's important to understand how chemotherapy is given and also some of the potential side effects you might get. It's also important to know how you can reduce or prevent these side effects. There are different types of chemotherapy treatments. The type you have may not be the same as someone else's. The type of treatment you'll have will depend on a number of factors. These include what kind of cancer you have, where it is in your body, how the cancer is affecting you, and your general state of health. Please ask any questions and tell us about any concerns you might have. This will help us all work together so you can get through the treatment more comfortably.
I started to read what I actually had, how to treat it. You know, I just got so much information, and that gave me the power then to debate with my doctor about, well, what are we going to do? And, you know, what sort of treatment should I have? What's going to happen to me?